Thank you all for joining us today, and welcome to this webinar titled Using the WSCC Framework to Improve School Health at the District and School Level. Now, as a quick introduction, Sophe is a nonprofit organization founded in 1950 dedicated to providing global leadership to the profession of health education and health promotion and to promote the health of all people. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Please plan to join us for Sophe's 21st Annual Advocacy Summit held on October 19th to 21st of 2019 in Washington, D.C. We encourage you to visit Sophe's website for additional information. Now, I am excited to introduce Christy Kay, President at Health Empowers. Christy is contracted to work with Sophe's School Health team, and she'll talk a little bit about Sophe's School Health project work under our cooperative agreement with the CDC and introduce today's speakers. Christy?
Thank you, Deanie, and welcome everyone. This is our final webinar in a series of 3 looking at the implementation of the whole school, whole community, whole child model in schools across the country. We are very excited today to present 2 dynamic speakers who will be able to share their experiences using the model at both the school and district levels to improve student health and learning. These speakers are actively engaged in this work on a day-to-day basis, so they will be able to share with us practical strategies, resources, and ideas that they have used. Our first speaker is Jana Stewart. Jana is the Wellness Coordinator for Project Healthy Schools in Michigan, and this organization is working to improve both present and future health of youth through school-based education, environmental initiatives, and engagement of the entire school community. She has a Master's of Science in Natural Resources and a Master's in Public Health, and has a strong interest in sustainable food systems and regularly volunteers at farms and food banks. Our second speaker is Dr. Michael Hines. Dr. Hines has served as Superintendent of Schools for Shelter Island School District and most recently Patch of Medford School District. In July, he will be starting a new superintendent position with Port Washington School District. His experiences include serving as Assistant Superintendent for Curriculum and Instruction and a principal at both the elementary and the middle school levels, as well as a teacher. He is an associate professor at Long Island University and Stony Brook University, teaching courses in school law, curriculum and instruction, school leadership, and has published numerous articles and podcasts on school leadership. So I'm very excited to present both of those, and Jana, I will turn the webinar over to you.
Great. Thank you, Christy. My name is Jana Stewart. I'm so grateful to be here today. Thank you to Sophe for inviting me to share some fun things about our work. I work at Project Healthy Schools out of the University of Michigan, and we're part of the state of Michigan's Building Healthy Community Partnership, which is a combination of people including Blue Cross Blue Shield of Michigan, Michigan Department of Health and Human Services, and others. So a few of my goals for today for us are to learn a little bit more about what our program does, and I'll share some examples of what that looks like on the ground, how it connects to the WSCC model. And as we go, I'll also share just some examples of some of the challenges that some of our schools have experienced in doing that work and some of the strategies that we've come up with to try to help alleviate those issues. So just to get us started, I want to give a little bit of background about our program. So the Little Star is where I am. I'm in Ann Arbor, Michigan. We are a Community University of Michigan collaboration, and we work in partnership with middle schools across the state to reduce childhood obesity and long-term cardiovascular risk. So we started with one school in 2004 and have since grown to about 100 schools all over the state, reaching about 75,000 sixth graders and many more who have been in the building. So we've really had to grow and adapt as we moved into different regions of the state that all have their own issues, challenges that we've had to work through. We are a grant and donor-funded program, so we put out a regular request for proposals. Schools apply to be in the program, and then based on the funding we have that year, we interview and select schools to implement the program the following year. So my job as a wellness coordinator is to help those schools in their first year go through the program, and then returning schools be there as their kind of reference and advisor as they need support going forward. So this is sort of a representation of the different activities that we would take at a school in a given year. So as you can see, there's generally quite a few strategies that we're pursuing at a given time. So such as like education, family engagement, opportunities. We work with food service. We form school wellness teams, help them work on school policies. There's generally a staff wellness component. So there's a lot going on. We kind of chunk it into areas of education, environment, and measurement. But generally speaking, when we've used this kind of graphic in the past, if I walk into a school, show them this picture, it seems like an overwhelming amount of work and tasks. And we never want a school to feel like, they can't even get started because they're just like frozen by the amount of work to do. So what we've actually shifted to is using a different graphic. We use this 5-step model now. So when I show a school that, it's generally to help them conceptualize the work that we'll be doing over the course of a school year, as well as a timeline for when things should happen. So those 5 steps are going to be designed to help schools get comfortable with our process, which is the same every year for every school when they're in the program. And once the school is participating with us, we want them to continue working each year. So we are not a one-year program. Once a school is in the community, we continue to engage with them year after year, depending on the amount of support that's needed. As you go, you expect schools to take more and more ownership, feel more comfortable doing this on their own, and that's the ideal. That's what we're shooting for. So the 5-step process is the same for everyone, but schools are also able to tailor to their specific areas of health and learning that interest them the most. So, for example, a school might be really interested in building their capacity for health education, whereas another school might be more interested in, family engagement, social emotional learning, and that's okay. Our program kind of standardizes the how, not the what. And so we're sort of an example of a school that gets inspiration for the what from the WSC model. So as many of you probably know already, the WSC has 10 different components, some of which are circled here on the slide. So the components I circled in red, those are really, they're core to our program. So they're really targeted in major ways by all of our schools. And we have standardized measures in place to help them gauge their progress in those areas. For example, for under health education, each school in our program has to teach our 10-lesson curriculum with their 6th graders. And then we have other additional curriculum they can use if they're interested, and we do surveys with students about the lessons at the end of the year. The orange circles are sort of the areas that are part of our program, but it varies from school to school in terms of how extensively they want to work on that component. So some schools find it really important to do a significant employee wellness piece, either because they have a need for having models in the building to model healthy behaviors for their students, or there's just a culture that they're trying to kind of shift by generating buy-in among staff. But another school might not see that as important, and they might do just one activity for staff that year. So that's where schools really customize our program. And then those yellow circles are the areas that are new for us. So as we grow and work with schools, we get feedback about what schools are most interested in, where they need more support. And so we're trying to develop more resources in these 2 areas, particular social emotional climate and having a curriculum around social emotional learning. So as you're all doing work at your schools, I would encourage you to not feel overwhelmed by how many components there are. It doesn't have to be hitting all of them at once. It's more about tackling those that you think are feasible for you, and it's an ongoing process and building on it as you go. So I'm going to shift a little bit over to being a little more specific about what our program actually entails so that you have some kind of examples of how it works. So our first step with a school is completing the school wellness team, putting that together. Could also be referred to as a coordinated school health team. I know there's a lot of names for it out there, but we help the school identify one single point person who's going to be the lead for this work. We provide them with some materials to help recruiting, And in some cases, we'll give presentations at parent and staff meetings to kind of generate support. And then that wellness team will be responsible for letting the school community know who they are, including parents, so that people know what's going on in the building and who they can reach out to if they're interested in helping. So our wellness teams look really different from school to school. Some are a mix of students and staff. Some are student only. There's really no right way to have a wellness team, just as long as they be an engaged group of individuals, which kind of leads me to my first lesson learned. So an area where some of our schools experience difficulty is when they have a wellness team that's kind of inactive or ineffective. And that's usually the result of someone being voluntold to participate rather than volunteering. And so it's really important to take time in the beginning to identify leaders who are committed and interested in the work. Otherwise, it's just one of those things that becomes too easy to reschedule or cancel meetings because it isn't the top priority. Or in some cases, when I've had wellness teams that have no shortage of ideas for things that they'd like to change, but there's no one person or a few people on the team who are willing to take an action item or do something to make a change. So team leaders should have, a willingness to lead, knowledge of resources in the school, and a passion for the project in order to keep things moving. And then my job as coordinator is usually to facilitate the first few wellness team meetings, to set some good norms around meeting practices, having agendas, taking minutes, having action items assigned, to kind of model what we want that best practice to be. Step 2 for our schools is completing, an assessment of their current school wellness culture. So that's going to give you a baseline for, where your students' behaviors are currently, what sort of a foundation exists to support school health. We do that by doing a pre-program behavioral questionnaire, which is measuring daily intake of fruits and vegetables, average screen time, how much physical activity they're getting, and then we share that with the school and then connect it later on with a post survey. And then the school wellness team, their first task as a group is to complete a needs assessment. So in Michigan, we use the state of Michigan's Healthy School Action Tool, but there's many others out there, including, I think, School Health Index, MyFi, and other organizations have their own. So they do that, and then our schools do a second assessment, a lunchroom assessment. The reason that we require that separately is because the lunchroom, the cafeteria, is really an area where there's always going to be tons of interest from staff and parents, or both. There's very few people that don't have a strong opinion about the cafeteria, and so we like to make sure that our schools have a way to initiate that conversation with some understanding of what's currently the practice, so that they can move forward with that. So another sort of lesson learned related to this is that a lot of our schools, they need administrative support in order for step 2 to be completed. A lot of the questions in the needs assessments out there require help from the principal to answer. It's data that staff just don't have access to. And so a big lesson learned for us has been, engaging those different stakeholder groups early and often, especially principals. They have lots of pressures on their shoulders as well, lots to do. But they're a really important piece of the puzzle. And often, there's a lot of overlap in the wellness team's goals and the principal's goals. So, they're interested in data collection, school improvement plans. And another thing that we've tried to do to help engage that group is help our schools apply for wellness awards. So the state of Michigan has a yearly school wellness award. We help our schools apply for that. So that they're, invited to Lansing, they get some recognition publicly for their school, and principals are always very grateful and excited when that happens. So in this case, this is a picture of one of our schools that won an award, and then we invited their local legislator at the state level to come over to the school and have a nice event with the kids. So those things always go over really well in building that stakeholder relationship. As a result, it's really paid off for us. We have a really high retention rate. 90% of the schools that go through our program the first year continue year after year since starting. So some of our schools have been doing it for 15 years, and some are, all the way down to just finished their first year and are planning to come back next year. So sustainability really is dependent upon how supportive all your stakeholders are at seeing this through and making it a priority in the building. Okay, step 3 is working on that action plan. So this is going to build off of that assessment that the schools do in step 2. So usually this is where I'm going to help a wellness team to tailor their plan to the areas that they're interested in. So where that WISP model really comes in to inform, what sort of topic areas do they want to target first? Do they have certain strengths in one area and not another? So we help them to go through that and identify some goals going forward for the wellness team to tackle that year. And then they get to start the fun part, right, which is the taking action. They teach all the 10 lessons in our curriculum, which are all very skills-based, hands-on. So we provide all of our schools with teaching materials that are reused every year, and then we'll repurchase each year the kind of the lesson disposables, the parts that get thrown away. So we have like a salad lesson that teaches kids about macro and micronutrients, and they make the salad in class, and that's one of the most memorable. So we'll be buying, the ingredients for that and all the disposable forks and plates and things. The wellness teams are also charged with doing at least 4 wellness initiatives, and those are extremely broad in what they actually look like. So a wellness initiative is anything that helps promote health in your building and speaks to your action plan. So, for example, the picture here is from a Michigan Apple Crunch Day tasting where all the students in the school crunched into a Michigan apple at the same exact time. So I'm envisioning that this school identified in their needs assessment that their students didn't have that many opportunities to sample local Michigan produce. And one of their action plan areas was, how do we help our students get more exposed to local fruits and vegetables so that they, feel more excited about trying new things and finding, great tasting fruits and veggies. So that's kind of an example of how that process works. But wellness initiatives could be one-time events. They could be, a new policy or a new system that's put in place to help connect students to resources. There's a wide gamut of things that it could be, including staff wellness events. But whatever it is, we're here to help guide that school toward those best practices and serve as a resource as they're planning things out. So one of the reasons why that environmental piece is so important to us is that as a research institution, U of M, it's really important that we be doing things that have a measurable impact. And so, most professionals know that education isn't kind of a silver bullet. There's a lot of different factors that influence our behavior from day to day. So we weren't that surprised to see that the evidence supports providing schools with various strategies, not just education. So education and environmental change we looked at, and we were kind of comparing students who had only the lessons versus those who had the lessons and the environmental piece. And as you can see, the changes in health behaviors, in terms of what they were eating and how much activity they were getting, while the students that had the lessons only did have kind of a marginal increase, positive increase in their behavior, the students who had both had between 2 and 5 times as much of an increase as the other students. So it's really valuable when you're having, school-based efforts that you're not doing just kind of one lane, that you have people bringing in multiple different components. Similarly, when we were looking at family engagement, which is another piece of our program, our curriculum has a parent packet that goes home with each lesson with the idea that the student has a conversation with their parent about how can we make changes at home that make it easier for me to do this behavior. Maybe it's that the family decides they're going to try to take a walk after dinner 2 or 3 times a week or something like that. So when we looked at students who had the lessons and the family engagement piece versus those that didn't share any information with their family after the lessons, you can see that the students who said yes were much more likely to eat more fruits and vegetables and be more physically active. So we sort of draw from that as we go and continue to, research what are the things that are having the highest impact on behavior and how can we fold that into our programming. Which ties in nicely to our last step, which is measuring success. So at the end of the year, schools are going to do that post-program survey with students so that we can measure, how much did their behaviors change as a result of this program? Are there certain behaviors where students are really struggling? At this age group, it tends to be screen time when they all get their phones. But then we also collect some qualitative information, success stories. We talk with food service about, sales in the cafeteria. And that information is generally always shared back with school board, principals, people who really need to see and hear about that important progress and why it's so important to keep going forward. And then kind of lastly, to wrap up kind of why our program is so proud of the work that we're doing, we have found that we've been effective at improving cardiovascular risk factors. So we've measured total cholesterol, LDL cholesterol, triglycerides, and blood pressure, and have had significant reductions for all of those. The co-founder of our program is Dr. Kim Eagle. He's the current director of the Cardiovascular Center at University of Michigan, and he's really excited about these numbers, which seem small, but when you look forward 5, 10, 20 years in the future, having lower levels of all of these are leading to really significant differences in the development of cardiovascular disease. So we're continuing to try to maintain or improve these as we go forward, as well as behavioral measures. So when we survey kids, making sure that they're actually increasing their physical activity and their fruit and vegetable consumption in meaningful ways. And here we had a group that had about an average of a 30-minute increase every day in their physical activity, paired with that kind of similar decrease in their screen time. And then lastly, we followed a group of students for several years throughout the program. So what you're looking at here is the baseline was their pretest when they were 6th graders. The first follow-up for each of these 4 measures was the end of their 6th grade year. Second follow-up is 7th, third follow-up is 8th, fourth follow-up is 9th grade when they go into high school. So what we took away from this is that being in that environment over time does have, an additional effect, that students continue to improve when they're in that environment that supports healthy choices, but that there's also a risk of kind of reverting back when they move into a new building. So, as we transition over to Michael in a few minutes, we learn it's really important to have a district-wide approach, because while we might support the students at the middle school level and have all these resources available, then they move to the high school, and that's an environment where they're going to form new habits once again. And we want to make sure that our students are supported, from beginning to end when they're in our school system. So, my advice for doing that kind of work would be to seek out sustainability by having as many partners on your team as possible. So maybe making a list of, within your area, what are the organizations and the people who have been most interested in this topic, or who know people who might know someone, and not being afraid to reach out and ask for help. In our situation, we ask for help a lot and have had really great success at people being willing to share their time and their expertise to help us in our work. And schools have had a similar situation. So even if it's the Rotary Club or the Chamber, or, a really interested parent, taking advantage of the people that really are interested and inspired by this work, and taking the time to do that well. So kind of an example of how our system works, or our partnership system works. Obviously, since we're at the University of Michigan, we have quite a few departments that have different expertise. So we try to offer as many different services as our schools are asking for. We partner with state organizations, nonprofits, volunteer students. That's another area that's probably a really good untapped resource for a lot of schools, is that there's college students, whether it's a large university or a community college, who are looking for, experience and volunteer time. So connecting with people who know those individuals and finding a way to reach out to them. So with that, I will move on and let Michael take it away with his district-wide approach.
All right. Well, thank you. First, I want to thank Deanie and Christy and Jana. That was really wonderful to listen to your presentation. I'm going to look at things from a district-wide approach, really from 30,000 feet. I like to kind of give visuals as far as, if you're at the ground level, you're usually a teacher assistant, principal, maybe seeing things at 5,000 feet, 10,000 feet, and then if you're an assistant soup, maybe 15,000, 20,000 as a superintendent. You're looking at the whole thing with the Board of Education. And with that, you have to be very deliberate as far as what you're going to focus on. And so over the next 20 minutes or so, I want to talk about the importance of the whole child education and wellness in school and what that actually means. And with that, I'm hoping over the next several minutes you'll understand what our purpose is, in my former school district in Patchogue, Medford, which is on Long Island. It's about an hour and 20 minutes away from New York City, east of. A pretty diverse community. Pretty much if you took New York State and its demographics and you shrunk it down, Patchogue, Medford is a microcosm of that. We have around 50%, a little more than that actually, free and reduced lunch. And it's a pretty diverse community, which is great. Which is great its strength. So through this presentation, I want to talk about the importance of recess, play, yoga, and mindfulness, the importance of paying attention to executive functioning skills and what that means, really unpacking what whole child education is. You know, I always say if I had 100 people in front of me and they had index cards and I asked them to define what whole child education is, I may get 100 different answers. Understanding what this plan looks like, how it came about, and then why I believe, and I'm hoping you do too, for the listeners out there, why it can work anywhere. So with that, that's a picture of me really getting down and dirty with the kids. We have the playrooms in each of our 7 elementary schools. We call them divergent thinking rooms or labs, and they construct things. And so we really believe that play in school is just as important as any content area that's being taught. And some of the things I'm about to share with you, is because it's all about perspective. And, you know, I ask people to look at this particular screen. I ask them what they look at, what they see. And sometimes, you know, they'll see the word good. Some of them see the word evil, and if they see the word evil, I ask them to leave because I want to talk to them. But it's, you know, based on what you see that's in front of you, and of course it's our collective experiences over time as far as how things land on us. And some of the things, again, I'm about to say, you may not agree with, which is totally fine. But this is an interesting one because this is so true. The National Superintendents Roundtable, which is an association of superintendents from around the United States, they came up with this wonderful report. And I can share the hyperlink if you would like afterward with this report. And basically it talks about, for the most part, American schools only focus on student outcomes, or for the most part focus on student outcomes and system outcomes, but they rarely really focus on inequity and inequality within schools, supports for schools, supports for young families, and of course, I think the most important, the social stress and violence that our students have to contend with. And I believe this model of focusing on wellness really plants kernels of hope within families and school districts. And we know the absence of hope is a very scary place to be. But I would have to say, moving through these slides, it gives, I think, school systems real concrete strategies if they really do want to focus on what's in the best interest of kids. In my humble opinion, I believe that when we just hyper-focus on standardized tests and assessments with kids, we're losing the purpose of education. And so our particular school district really wanted to move away from that narrative. And if you think about it, on average, this is from the Council of Big City Schools. This came out about a few years ago. On average, students take about 112 standardized tests. That's not counting all tests, just standardized tests, pre-K through 12, which almost equates to 40 full days of kids taking tests. And that means, you know, there are byproducts of that. You know, there are unintended or maybe intended consequences. If you think about it, children are in school for over 14,000 hours throughout their lifetime, which is really, really interesting. So within that time, what can we do to really focus on what's in the best interest of kids? So there is a process, and there is a process to really unpack why recess play and yoga is so important. I think in some, and I'm generalizing when I say this, but I think in many school systems, there's rarely a graduate profile, meaning that, you know, what is the ultimate exit outcome when you want kids to graduate after being in school for 13 plus years? You know, workforce, college, certainly in military service. So this is, when we look at the 5 non-negotiable attributes that we want kids to walk away with, it's really being a critical thinker, skilled communicator, focusing on intrapersonal skills and interpersonal skills, as Howard Gardner would say, right? knowing yourself, diving deep into who you are, what makes you tick, and then, having the ability to connect with others, being resourceful, and then finally having a sense of community. But in order for us, I believe, as our particular school district, to move forward, we had to follow certain steps. And John Kotter has a wonderful book out of Harvard University called Our Iceberg is Melting. It's very simple to read. It's really an adorable book, but it's steeped in research. And there are 8 specific steps that one can take from 30,000 feet if they are looking to go from point A to point B. The first thing that Kotter talks about is creating a sense of urgency. Like, here is the problem. We need to do something about it now. And then he goes through 7 other steps as far as how you go about building this vision and mission moving forward. You build a coalition, you form a change vision, and you keep going on until you have a change of culture, which, as you know, takes time. During this process, we truly believe that students are not standardized. I talk about this all the time. Certainly, Sir Ken Robinson brings this up often in many of his TED Talks, right? The fact that students are all different and they all learn differently, and we need to embrace that. In order for us to move forward within our particular school district, we had to recreate our new vision and mission, and that is not easy to do. In order to do that, we had to bring lots of stakeholders on board from an eclectic, mix of, I want to say, community members, whether it's internal or external within the school system itself. And we asked the question of what do we want our vision to be, that everyone would remember, right? Because a lot of visions, and again, I'm hyper-generalizing when I say this too, is that if you walk into a school, what's your vision, what's your mission? For the most part, a lot of people don't know. I'd like to think at this particular point, a lot of the people in our school district does, because what it focuses on is not only cultivating the talents and the potential that kids have, but then just as important, then how do we create those opportunities for kids? What can we do to create multiple pathways to have meaningful experiences for kids? And that's the vision and the mission of the school district. We had to take the old one, which I think was created when Reagan was in the White House many, many years ago, right, back in the 80s, and we had to redefine and recraft and redesign what that was. And once we did that, we then talked about, well, why are kids here? Aside from the fact that it's required by law that kids had to be here, what was the real purpose of education? And we had to really think about that, right? I mean, this is a picture from many, many years ago, but many school systems pretty much look the same. It looks like it's in color. And Ken Robinson talks about in one of his TED Talks about divergent thinking. And if you ever have a chance to think, to read the book Breakpoint and Beyond, and to understand the differences between divergent and convergent thinking. Divergent thinking is really taking a problem, right, and attacking it from multiple different avenues to come up with an answer. Convergent thinking is the complete opposite. You can think of multiple choice tests, one problem, one solution. We wanted to really unpack that and understand what can we do differently within our school system to have more divergent thinkers. And again, this talks about here very quickly what the longitudinal study of divergent thinking looks like, right? So when kindergartners, over 1,500 kindergartners took the divergent thinking test, 98% of them actually scored at the genius level. But when you look 10 years later, when they took the same particular test, only 10% did. And what that was really telling us is, two things are happening. Either kids are getting dumber as they're moving through the system, or they're losing their sense of creativity and their ability to think different. So I learned a lot when I, as a superintendent, shadow students. And when I shadow students, it allowed me to see what life is like through their lens. And let me tell you, if you haven't done that in a long time, A, it's exhausting, and B, it really does open your eyes to what school is really like, either for a kindergartner or for students who are in high school taking multiple AP courses. So I actually got to see the life through their eyes and to understand through their voices, through the superintendent's roundtable, what they felt was effective and not effective, and to give me real feedback through time as far as how can we change this system. Well, here's some of the things that we found. We found that kids need to move often. We also found that kids, we believe, need time to play and explore a heck of a lot more than what they're doing right now. Physical activity and movement is paramount, but how do we have this take place at the secondary level? It's certainly a lot easier to embed this at the elementary, but what can we do to make this happen at the secondary level? They love recess, which is great, and I'll talk about what we've done for recess over time. Yoga and mindfulness, we've embedded that over the past several years. We actually have a full-time yoga instructor now working with our kids several times a year in mindfulness training, not only for the students but for the educators as well, which is just as, if not more important. And then we realized that a lot of our high school kids were not taking lunch, taking these little mini brain breaks to just actually decompress, and what was the impacts of that, which I'm just saying from my perspective, I think is really not a good idea. I am not a big fan of students taking 8 or 9 periods of classes in a row, not having lunch. I feel that's very unhealthy, but again, that's just my humble opinion. When you look at these PET scans, right, you look at the average composite of 20 students' brains taking the same test, and you look at to the left, the brain, what it looks like after sitting quietly. It's all blue. There's very little blood flow. After walking for 20 minutes, you can make the supposition that more blood flow, which means they're ready to rock and roll when they're in class. And those are the things that we really held near and dear to our hearts as we were creating multiple opportunities for kids to move often, which was really important for us. But the other thing that was important for us, too, is to create a sense of balance. And what I mean by that is not making the sole vision and mission of the school experience just focusing on content and a delivery system of just, making sure kids can understand ELA, math, science, and social studies. There's a lot more to schooling than that. And so we designed this acronym about PEAS, which we believe the real purpose of education is to have physical growth for students, emotional growth, academic growth, and social growth. And we feel if you had this synergistic union between the 4 of them, we believe you maximize human potential, which is extremely important, right? So how do students find their talents within the school day, and then how do we maximize their potential? How do students know after they exit our system, after a long period of time, right, what they're actually good at and what they want to do in life? So here are some of the things over the years that we embedded into our 5-year plan. There are some philosophical shifts. We've doubled recess from 20 minutes to 40 minutes. And when we first did that, you would have thought, the biggest news event was happening in New York State. And that just shows you the state of where we are, I believe, in society. The fact that a school district doubles recess and it's newsworthy is for me, is a little scary, to be honest with you. I just couldn't believe that it was. But not only was it newsworthy locally or even statewide, it actually drew national attention, which I found really interesting. We've also increased our unstructured play as far as K through 8. When I first came to the school district, there were no kitchen sets, no building blocks, no Legos, no Play-Doh. It was almost like you were in an institution of sorts. It was like a hybrid between a prison and a hospital, especially at the primary levels, which to me is just horrific. So what we did was we redesigned that. We brought back play, unstructured play, as Dr. Peter Gray would say from Boston College, self-directed play and those opportunities for kids. As I said before, we embedded yoga and meditation. We have meditation rooms and yoga rooms within our schools at the elementary level and some of the middle schools that are there. We have a real focus on project-based learning to focus on those divergent thinking opportunities for kids. We want to make sure that children, their social and emotional needs are met and what that means and what can we do within the system. We've almost doubled the amount of social workers over the past 5 years to make sure that not only their needs are being met, but the parents' needs are being met, which I'll talk about in a little bit. And then we talked about, staff training and professional development. A lot of us as educators, we took classes, right, to become teachers, and we understood who Piaget was. We understood who Maslow was. We kind of took maybe, 10-minute course on, who Erik Erikson was and understanding child development. But it is extremely important that anybody who comes in contact with kids understands the different developmental stages of learning, whether it's Kohlberg as well as far as moral development. So we created videos for our staff members to learn from. Fred Rogers, he's one of my idols. Play, recess, yoga, and mindfulness. Some people think it's squishy. Some people think it's not as important as academics, but for us, it is. It's where the real work begins, especially when it comes to play. And so as I talked about before, I'll show a couple of different images of some of our kids as they move toward blocks and playing with Lincoln logs and having opportunities throughout the day, every day at the elementary level to have this undirected time, or self-directed time, I should say. Every Friday for the fall and for the spring, before school for an hour, they have opportunities, K through 5, mixed age play, to do whatever they want. And the adults, their job is to get out of the way, to make sure that they are not interfering with what's taking place. And any of you who know Dr. Peter Gray's research, as I said before, it is just significant as far as what the impact is for kids. Some images of yoga and mindfulness as far as what this looks like. You see these images, and again, it's not just the students who are doing it, it's the adults as well, which is really important. You talk about the ability for students to recalibrate when they feel a solar flare, inside is about to come. We have seen discipline referrals decrease significantly. We have seen attendance actually increase within our schools by looking at these shifts. This is me getting stuck on one of the slides on the way down on a very cold day. And by the way, I truly believe kids should be going outside. I don't care what the weather is. They need to be outside. When I was in Finland for over 80 hours in classroom, 75 to 80 hours, what I noticed was not only were kids outside several times throughout the day, but it doesn't matter what the weather's like, they're going outside, and that's extremely important. So those are, shifts, not only I would say from a policy perspective, but even from, I would say, a philosophical one. We want kids to move and to be outside. So, of course, you have to put your money where your mouth is, and you invest in equipment for kids. If they're going to go outside, you want to make sure that they have the proper equipment for them to use. And so in 7 of our elementary schools starting next year in September, they're going to have 7 new elementary playgrounds, which is really amazing. We also tweet this on social media, so whether it's, again, through Twitter or Facebook, we want our community to know what their kids are doing throughout the day, and that's really, really important. Field trips, not field tests. That's one of my favorite quotes. Kids playing. Not only playing chess or checkers or doing whatever or Uno, they're just mixing it up as much as they can. Lots of Play-Doh for our kids. And by the way, not just for the primary school kids, but for the intermediate ones as well. For the sake of time, I have about 5 minutes left. I just again want to unpack a few more slides. We have exercise equipment that we've invested in outside. You can see snow that's outside, and you know what? The kids are outside and they're loving it. Maybe the adults aren't loving it as much as the kids, but the kids are outside. And again, we brought back games. Kids nowadays, it's really remarkable. They don't know how to play board games. They don't know how to interact with each other. We know that what the positive impact is of understanding how not only to play games, but to take turns, to be creative, to be empathetic, to follow rules. All those different things they learn as they're playing games. This is a few images of the before school play club. They can be indoors, they can be outdoors, whatever they choose. They can build things, they can do whatever they want. I know it's working because at the time when I was working there, if I ever took it away, I don't think I would have made it to my car because people would have been so upset. Divergent thinking rooms. So these are like the laboratories where kids can construct things. They could build things. They can make stories about whatever they built, and then they put everything away, which is a real wonderful skill to have. This is, again, Dr. Peter Gray, not to keep talking about him, but he actually came to our school a couple of times. He was actually conducting some research with our before-school play club. He has a wonderful TED Talk that I fully recommend that everyone listens to. It's a wonderful TED Talk. His book, Free to Learn, is an amazing book that I would encourage everyone to find out as well. When I was in Finland, with the 2 minutes I have remaining, I always say it changed my educational soul. It really, really changed the way that I view not only the purpose of schooling. I met with the head person who's in charge of all the schools in Finland, and I asked him, what's the most important thing for you to make sure what's happening in school? And he said two things. One is trust, making sure the teachers trust what they're doing from a policy standpoint and vice versa, and they trust them, which they do. And the second thing is wellness. They cared about how their kids were from a wellness perspective, and not only the students, but the adults who were serving their students as well. So I would say Piaget had it right as far as what the purpose of school is. The principal goal of education is to create individuals who are capable of doing new things and not simply of repeating what other generations have done before. And if we keep doing what we have been doing forever, that is not going to happen, unfortunately. We had the honor and opportunity to have Sir Ken Robinson speak to our school district this past fall. And again, what he focused on was not only the things that we were doing within our school district, but I have to say, certainly talking about wellness and what we can do to make sure that moves forward, not only in New York State, but around this wonderful and great nation. So I just want to thank everyone for me going through those slides as quickly as I could. And, as far as I'm concerned, we need to really revisit what the purpose of education is and what we want for the return on that investment after students are in school for 13 years. So thank you.
Thank you so much to our presenters. These presentations were amazing. So now we're going to move to the question and answer segment. So just a reminder to all the participants, please drop all of your questions into the chat box, and we will get to as many of them as possible. And so to start off, Claire Barnett asks if Jana, you could address how the University of Michigan's model works to improve the physical environment of local schools, such as specifically led in DW and paint. Not exactly sure what DW stands for, but DW and paint and better indoor air.
I think it's drinking water.
Okay, that makes sense.
Yeah, I'm happy to. So as a kind of case example of some of the work that we've been doing in the Flint area, there are quite a few organizations in that area already kind of coming into support. But from our program's kind of perspective at the middle school, part of that is to get with researchers on what are the best ways to kind of treat kids who have higher lead levels. And one of the ways to do that is just by having an increase in the vitamins and minerals you're going to get from fruits and vegetables. So there's been a pretty significant push in that community around bringing in extra farmers markets, having school gardens. In a lot of other schools across the state, we do a lot with drinking water, so installing water bottle filling stations with filters on them that can filter out certain chemicals that we know will be kind of higher risk for that area. Another environmental improvement for us is generally having additional equipment or kind of safe routes to school. So we will often help our schools apply for grants to get additional sidewalks installed or additional bike racks so that their kids can have more active transport to and from school. So those are some of the examples, but just generally speaking, in working with each school, if there's a certain issue that is important for them, and it's a really big issue like some of those that you're talking about with air quality and water quality, that's generally something that we're going to move up to the district level and help them to either by me meeting with the superintendent myself or someone else. In some cases, we go and we advocate at the Capitol about certain bills that we want passed and one example being idling in Detroit is an issue in certain neighborhoods, so trucks coming through and making the air quality worse by idling. So we try to be involved in all the areas that are going to really impact the daily wellness of our kids, and that's a pretty broad task, so we try to be open about it. Hope that answered your question.
Awesome. So Brittany Harris asked Jana if there is a pre-K component to your program.
So our program works with any building that has sixth grade in it. We do that because that's what our curriculum's written towards. So we have K through 8 schools that we work with and 6-8 schools. We don't have a model that's specifically for that group, but as part of that Building Healthy Communities partnership that we're part of, we're kind of considered the middle school version. And there's also a pre-K elementary version that's offered through Wayne State University. So there are other programs out there that are kind of similarly modeled as ours, but that one's run by another group that has curriculum for that level.
Awesome. And then just as an FYI, because I see a couple people have asked, yes, this webinar is recorded and you will be able to listen to it. I'll mention more about that towards the very end, but I see some questions coming in about that, so just wanted to clarify that. Marika Peterson asked, do you have elementary physical education instructors for your school? I think this question is meant for Michael.
Yeah, we do have physical education educators for all of our elementary schools, and students have physical education several days a week.
And then for either presenter, what is your advice looking at the school from a community partner perspective? How do you best gain buy-in from school administration and staff? And this is 3 questions in one. And how do you best encourage schools to be open with health and whole child programming?
Jana, you want to take a stab at that first? Do you want me to start it?
Either way. Do you have a thought?
All right. Yeah, if you don't mind. So
sure.
for us, it was very easy to do. We developed something called a Family Service Center, which I failed to mention, which is really like a community school model, and with that, this particular organization that works within our school actually works with other agencies in our school community. So that's for mental health, that's for dental, that's for vision, that's for a whole host of things that parents and students may need. And so with that particular resource, and they have a social worker, there's a lot of outreach to different aspects of the school community that's there. That's been extremely helpful. The other thing I think is really important is to invite them into your schools and to showcase, not only what's happening, but then think of ways to brainstorm how they could effectively help not only the students but the families as well. And as far as the administrators are concerned, that's not as easy, because there are some administrators who I think truly believe that it's academic or nothing, or it's academic and some of these things are secondary or tertiary. But they're all interconnected. We all know, without taking up too much time, that it's very difficult for any of us to function if we're not feeling well, if we don't get enough sleep, if we don't eat, whatever it may be. And so by making that one of your focal points from a vision standpoint, I think it gets more people on board.
Yeah, and I would add, as an external party who is often coming into a school district trying to kind of sell health, right, over, focusing entirely on academics. First of all, we try to just educate. Sometimes they just don't know how impactful movement throughout the day and eating healthy has on their students' learning. So that's where we start. And the second is building relationships. So I have an example of a school where we started doing a mindfulness intervention as part of their detention, kind of an alternate detention program. And the principals were like, yeah, that sounds nice and fluffy, but how's that going to help anybody? And so I made the principals sit down with me, and I walked them through what the students were going to experience. And when they had a good experience themselves and noticed, oh, wow, I don't feel like I want to punch a hole through a wall right now. This might actually be, something to try with our kids. I think sometimes they just need to see it or hear some success stories to kind of get it.
So another question for you, Michael. What kinds of health-related outcomes have you found through the interventions that you've taken within your school district?
Well, I think it's hard for me to say what the outcomes are because we're not measuring it as much as we probably should right now. But I will say it's leading to other things. Namely, we just budgeted for and we'll have it constructed a massive greenhouse at the high school. And with that, whatever food is grown there will be integrated to the cafeteria, which is really amazing. The second thing is we have something called breakfast in the classrooms. And so meaning that because we had almost half the kids on a free and reduced lunch, everybody for free eats breakfast in the classroom together. And it's communal and it's healthy. And so the only thing I could tell you is probably from a qualitative standpoint is that the teachers notice a difference with all the students because they're eating together and they're eating healthy. They're all fed, and then after that they go right into their lessons. So I don't have any data to say offhand, what some of the outcomes are, if they're healthier. But I will say I think from a functioning standpoint and from a school attendance standpoint and a discipline standpoint, they're doing much better.
Thank you. And do either of you have a tip that you can share on how you got involved with the health and wellness champion within your school or district, or how others can get involved or be that champion, especially if there isn't one already in your school district or in your school building?
Well, with our program, it's a little easier at the start because there has to be a person who submits an application to get the program at their building. But I can say that when we have, if that person moves on, gets a new job somewhere else, and we have to find a new one, one of the things that I try is usually to find out who's the most interested in by masking it as a wellness survey for staff. So I'll go to a staff meeting, present about the team, and then kind of distribute a survey that's anonymous, and there will be an area at the bottom where people can kind of rate how interested they are in areas of health, and if they're interested in helping in some way, that they should write their name down so I can contact them. And more often than not, about half the people write down that they'd be willing to help with something. So sometimes just asking point blank for people to say out loud, like, oh, I'll do it. Sometimes they need some time to think about it, or they want to write it down rather than say it in front of their colleagues. But that's with our program. If you're in a district that doesn't have a program like that currently, I would just encourage you to talk to your principal or find other people on staff that are a natural fit, like food service probably is interested in doing more in their lunchroom but doesn't have the support to do it. So finding those people who are going to be kind of a key player in it and letting them know that you're interested in doing something.
Yeah, and then real briefly, oh, sorry.
No, it's okay. Go ahead.
Yeah. Oh, should I answer it?
You can really briefly.
Real quick. So I would do two things. One is arm yourself with research as much as you can. And the CDC has multiple research reports that I think it's really hard to say no to, like how this isn't like universal. These aren't universal best practices. If we're so caught up in comparing ourselves to what's happening internationally, you should look at what some of the schools are doing internationally then. And it's almost a complete opposite of what we're doing here in America. So they want to be a champion, really understand, I think, other school systems around the world and what they're doing, and then, be that person, at the boardroom or with the principal and saying, this is what I'd like. Talk to PTAs, go to board meetings, and start asking for those policy changes.
Awesome. Well, thank you all for the great questions. Unfortunately, we couldn't get to all of them, but if the presenters are willing, I know that Jana provided her email in the presentation, but if the presenters are willing and interested, you can drop your email if there are any questions that we didn't get to. Um, on behalf of Sophe, we want to thank you all, both you, Jana, and Michael, and thank all our participants today. Once again, today's webinar was recorded and will be able to be located on our YouTube channel for Sophe's Schoolhouse playlist within the next week, and it'll also be archived within 2 weeks on Sophe's Core for those who were asking about continuing education credit. Please take a moment to complete the brief SurveyMonkey that will come up in your email inboxes within the next few minutes, and give us your feedback on this webinar. And again, if you're interested in continuing education credits, please visit Sophe's Core. Thank you. This ends our session today.
Thank you. Please stand by.